Today, we will explore medications that can be prescribed but are generally avoided by doctors for extended periods. I will present 5 medications that, in my view, should not be used long term. Relying on medications over a prolonged time frame typically signifies a chronic issue, and focusing solely on alleviating symptoms without addressing the underlying cause might not be the best strategy. Although temporary relief from symptoms is vital for lowering stress and enhancing quality of life, ongoing use of medications without treating the root cause can be worrisome. Thus, I'd like to highlight 5 categories of medications that doctors tend to avoid for extended use. Let's dive in. 1. Sleep medications, Zolpidem. One medication I would advise against for prolonged use is sleep medication like Zolpidem, commonly known as Stilnox or Ambien. These medications are often prescribed for insomnia and are recognized for their quick action and brief duration of effectiveness. However, long-term use of Zolpidem poses various risks, including falls, dizziness, daytime drowsiness, and even unusual behaviors like nonsensical conversations or memory lapses. In elderly patients, the risk of falls rises significantly, and extended use may lead to dependence. Abruptly stopping the medication can result in rebound insomnia or withdrawal symptoms. Many individuals develop an exaggerated fear of being unable to sleep, which heightens anxiety and exacerbates insomnia. Instead of depending on sleep medications, implementing behavioral changes and practicing good sleep hygiene is more effective. This includes going to bed only when genuinely tired, avoiding electronic devices in bed, and maintaining a consistent wake-up time even after a poor night's sleep. Relaxing activities like meditation or reading before bedtime can also be beneficial. Beyond these risks, prolonged use of sleep medications can adversely affect sleep quality. While these medications may assist in falling asleep, they can disrupt natural sleep architecture, leading to less time spent in deeper, restorative sleep stages, such as REM sleep. Consequently, individuals may feel unrested even after a full night's sleep. Another concern with long-term sleep medication use is the potential for drug interactions. Many of these medications are metabolized by the liver and can interact with other drugs, alcohol, and certain foods, leading to heightened side effects and risks. It is crucial to note that insomnia can be a symptom of underlying mental health issues like anxiety and depression. In such cases, addressing the root condition may be more effective than relying on long-term sleep medications. Cognitive behavioral therapy, CBT, is an effective non-drug approach for insomnia, helping patients identify and modify thoughts and behaviors contributing to sleep difficulties. Other strategies to enhance sleep quality include creating a comfortable, quiet sleep environment, engaging in regular physical activity, avoiding intense workouts close to bedtime, limiting caffeine and alcohol intake, particularly at night, and managing stress through relaxation methods like deep breathing and yoga. In cases of chronic or severe insomnia, seeking medical guidance to evaluate underlying causes and determine the optimal treatment approach is essential. While sleep medications may be warranted in some instances, it's crucial to weigh the risks and benefits of long-term use and explore safer, more sustainable alternatives whenever possible. 2. Proton pump inhibitors, PPIs. Medication I would recommend avoiding long-term is proton pump inhibitors, PPIs, such as omeprazole, which are frequently prescribed to treat acid reflux and stomach ulcers. These medications decrease stomach acid production, helping relieve reflux symptoms and facilitating ulcer healing. However, long-term PPI use is associated with numerous risks, including vitamin B12 deficiency, poor absorption of magnesium, calcium, and iron, an increased risk of pneumonia, osteoporosis, and even gastric cancer. Moreover, these medications can compromise the stomach's natural defenses, allowing bacteria and other pathogens to infiltrate the digestive tract. Interestingly, studies suggest that regularly consuming water can provide temporary relief from acid reflux symptoms, akin to medication use. Therefore, rather than relying on PPIs long-term, it's more effective to address the underlying causes of reflux, such as being overweight or having unhealthy dietary habits. For many individuals, lifestyle adjustments like weight loss and dietary improvements can effectively manage reflux without medication. Another issue with extended PPI use is the potential for drug interactions. These medications may hinder the absorption and efficacy of other drugs, including blood thinners, antidepressants, and osteoporosis treatments, leading to serious, potentially life-threatening complications, particularly in elderly patients or those with multiple health conditions. Additionally, long-term PPI use might increase the risk of Clostridium difficile infection, a bacterium causing severe and potentially fatal diarrhea. This occurs because PPIs disrupt the natural bacterial balance in the digestive tract, creating a more favorable environment for harmful bacteria to proliferate. It's essential to note that while PPIs may be necessary for treating specific conditions, such as stomach ulcers or erosive esophagitis, they should not be used indefinitely without medical supervision. If acid reflux symptoms persist despite lifestyle changes, alternative treatments like H2 receptor antagonists, famotidine, or antacids should be explored before resorting to PPIs. When PPI use is necessary, it's vital that patients are closely monitored and that the dose and treatment duration are minimized. Patients should be cautioned against abruptly stopping PPI use, as this can lead to a rebound effect with increased stomach acid production, worsening reflux symptoms. 3. Painkillers, NSAIDs. Non-steroidal anti-inflammatory drugs, NSAIDs, which are among the most commonly used medications worldwide. Examples include Loxonin, Loxaprofen, Voltaren, Diclofenac, and ibuprofen, some of which are available over the counter. However, NSAIDs come with various risks, including cardiovascular complications. Research indicates that long-term use of these medications can raise the likelihood of heart failure by approximately 20%, with higher doses and extended durations increasing the risk further. Additionally, these drugs can cause gastrointestinal damage, leading to ulcers and bleeding in the digestive system. In severe instances, this could result in stomach or intestinal perforations. Most bleeding ulcers are linked to extended NSAID consumption. Another concern with long-term NSAID usage is their effect on kidney function, which may lead to issues such as fluid retention and swelling. While not all users exhibit visible swelling, around 5% showed noticeable symptoms. Therefore, it's crucial to limit NSAID use and focus on addressing the underlying pain causes, like knee or back issues, rather than relying on painkillers for the long haul. Beyond cardiovascular, gastrointestinal, and kidney risks, prolonged NSAID use can result in other side effects such as dizziness, headaches, and allergies. Some individuals might experience severe allergic reactions, including skin rashes, breathing difficulties, and facial swelling. Although NSAIDs can effectively relieve pain and inflammation, they do not tackle the underlying issue. Therefore, seeking medical advice to identify and properly address the pain source is essential. Instead of solely depending on medications to manage symptoms, safer and more natural pain relief alternatives include relaxation techniques, low-impact exercises, physical therapy, and acupuncture. Lifestyle adjustments like maintaining good posture, engaging in regular physical activity, and keeping a healthy weight can also help prevent and reduce chronic pain. For acute pain cases or when NSAIDs are necessary, it is vital to adhere to medical recommendations and package instructions respecting suggested dosages and treatment durations. Irresponsible and prolonged NSAID use can lead to severe health risks, so it is important to be aware of potential side effects and explore safer alternatives whenever feasible. 4. Statins. The medication I would advise against for long-term use is statins, commonly prescribed to lower cholesterol levels. Statins are often recommended to decrease the risk of heart disease. Discovered by Japanese scientist Dr. Akira Endo, statins are regarded as one of the most significant medical breakthroughs, potentially reducing heart disease risk by 30% to 40%, according to some studies. However, it's crucial to interpret this data accurately. In a significant study, about 3% of participants not taking the medication experienced heart attacks, while the figure dropped to 2% among those on statins. This indicates a relative reduction of 30%, but in absolute terms, it translates to only a 1% reduction. Thus, to prevent one heart attack in one individual, many others must take the medication without direct advantages. Moreover, statins can result in side effects like muscle damage, rhabdomyolysis, and mitochondrial dysfunction, as well as heightening the risk of hemorrhagic stroke. While it's essential for individuals who have experienced a heart attack to continue using statins, those with merely high cholesterol might find lifestyle changes to be a healthier and more effective alternative. Personally, I would avoid extended statin use if high cholesterol were the sole issue without accompanying cardiac complications. Another concern is that prolonged statin usage can elevate the risk of type 2 diabetes, with studies suggesting that the risk of developing diabetes may increase by up to 50%. This is particularly alarming since diabetes is a significant risk factor for heart disease and other health problems. Additionally, some users report cognitive issues, such as memory problems, confusion, and difficulty concentrating during long-term statin use. While these side effects are usually reversible after discontinuation, they can be bothersome and negatively impact quality of life. It's important to recognize that while statins may be necessary and beneficial for individuals at high risk of heart disease, especially those with a history of heart attacks or other severe cardiovascular conditions, alternative methods should be considered before resorting to long-term statin use for individuals with high cholesterol as their only risk factor. Lifestyle modifications, including a nutritious diet rich in fruits, vegetables, whole grains, and healthy fats, combined with regular physical activity, can effectively lower cholesterol and enhance heart health. Stress management, maintaining a healthy weight, and avoiding tobacco use are also crucial in heart disease prevention. Before starting or discontinuing statin use, consulting a healthcare professional to evaluate individual risks and benefits is vital, as everyone has unique health needs. 5. Diabetes medications, SGLT2 inhibitors. The category of medication I would recommend avoiding for long-term use is SGLT2 inhibitors, utilized in treating type 2 diabetes. These medications prevent the reabsorption of glucose by the kidneys, resulting in excess glucose being eliminated through urine. This process helps lower blood glucose levels, but also raises the risk of urinary and genital infections, particularly in women. Moreover, excessive glucose loss can lead to weakness, fatigue, and dehydration. While these medications may benefit diabetes patients with heart or kidney diseases, attempting to manage diabetes through diet and exercise is preferable before turning to long-term medications. Another potentially serious side effect of SGLT2 inhibitors is the heightened risk of diabetic ketoacidosis, a condition arising when the body produces high levels of ketones due to insufficient insulin. Although more common in type 1 diabetes patients, diabetic ketoacidosis can also occur in those with type 2 diabetes using SGLT2 inhibitors. Symptoms include nausea, vomiting, abdominal pain, confusion, and shortness of breath. If untreated, diabetic ketoacidosis may lead to coma or even death. Furthermore, SGLT2 inhibitors could increase the risk of amputations, particularly of toes or legs, especially in individuals with peripheral artery disease or diabetic neuropathy. It's crucial for patients on these medications to carefully monitor their feet and legs and report any wounds, ulcers, or infections to their healthcare provider immediately. It's worth emphasizing that for many type 2 diabetes patients, lifestyle modifications like adopting a healthy diet, exercising regularly, and maintaining a healthy weight can sufficiently control blood glucose levels. Even modest weight loss can significantly enhance insulin sensitivity and reduce medication reliance. When lifestyle changes are insufficient for diabetes management, other medications like metformin may be considered prior to resorting to SGLT2 inhibitors. Metformin is typically the first-line treatment for type 2 diabetes due to its effectiveness, safety, and tolerability for most patients. If SGLT2 inhibitors are necessary, close monitoring for side effects or complications is essential. Patients should be encouraged to stay hydrated, to prevent dehydration, and to report any symptoms of urinary or genital infections, diabetic ketoacidosis, or foot and leg issues to their physician promptly. Conclusion. In summary, it is crucial to address the root causes of health issues rather than simply masking symptoms with long-term medications. While medications may be necessary in certain cases, such as for individuals who have previously experienced a heart attack or are at risk of kidney failure, striving to change lifestyle habits to enhance health is always preferable. I hope you found this discussion helpful. If you enjoyed the video, please give it a thumbs up and follow the channel for more content like this.